Good afternoon. I'm very pleased to speak to the Guyanese population through, of course, the media after a full day of engagement with REOs, regional health officers, regional education officers, and members of cabinet who are directly responsible for important investments across the country. As you know, we have made a commitment of ensuring quality service to the Guyanese people. What is important for us is a high standard of quality service. Today, we had an opportunity to assess the investments we have been making, a very open and frank discourse on some of the challenges, some of the things that we are dissatisfied with, and looking at how we will confront these challenges in ensuring that the population receive the optimal value and benefit of the investments we are making. The ministers of education and health and ministers in local government are a key part of this strategy today. Because as you're aware, we want to ensure every member in our population have access to quality, world-class education and world-class health services. And that requires all hands on deck. The Ministry of Local Government has the responsibility of ensuring the regions implement programs at the regional and community level, and of course the Minister of Finance in not only the allocation of funds, but also in monitoring and evaluation. These sectors, education and health, of which we want to focus today, have had enormous success in the last 4 years. The task of building a new infrastructure to meet the demands, rehabilitating and improving existing structures, but more importantly, the work that you can't physically see, that is investment in the system, investment in building efficiency, the textbooks, investment in the training of nurses, training of teachers. These are key investments. And we have seen where we have public service leadership that is performing. We have seen how these investments have changed structurally the lives of people in these regions. We were examining every single region, and a region that stands out in the way in which you see the demonstrated impact of the investment because of that added push. For example, Region 9, taken as an example. And all the other regions where our investment is bearing fruits. As you know, Budget 2025 focuses heavily on community investment. And in order for us to make the additional investments and to appreciate what is needed, we had to have a very open discourse on what the challenges are, where the weaknesses are, and how we fix those challenges and weaknesses. And we have set today the minimum standards that we'll accept in facilities in every community for health and education. I have said also that, for example, our patients should not be coming every month just to have the replenishment of their medical supplies. That every health center must upkeep a full register of all the patients, chronic disease patients, and their medical supply needs. And they must be given 3 months' supplies. And if their clinic date, at their clinic date, their doctor recommends a change, then that change goes into the system. What we really sought to achieve today was finding the formula that would fix existing issues, the inefficiencies in the system, whether it's the small issues like washroom, sanitation, issues within health centers, health outposts, schools, or whether it was structural issues of changing the system to make it more people-centered and people-oriented, and that's what we want. We want to reduce the costs of people receiving government business, reduce the time it takes them to receive government service, and improve the quality and delivery of that service. And that is being more direct, being more approachable, creating a more customer-oriented environment, and ensuring that all the investments that we are making deliver at the optimum level. So we focus on fixing what needs to be fixed. We had a full discourse on all the gaps that exist, and all the program heads in the regions have been given a clear mandate, a clear strategy has been outlined, and I've made it very clear that they're going to be held accountable for the delivery of service to people. Service that is efficient, reliable, transparent, accountable, open, and ensuring that our systems work. That is key. We have been making tremendous investment to improve the lives of our people. And it is key that bureaucracy or people does not form an impediment in service delivery. And I think from everyone here, we had a very frank discussion, open discussion, as I said, and there is full commitment and appreciation for the investment that is being made, and also from the technicians themselves, a voluntary commitment of doing more and making that sacrifice for the people. They have also raised human resource challenges, finding workers, finding drivers, ambulance drivers, drivers for vehicles, finding medical technicians, porters, engineers, plumbers, mechanics. All the program heads would have outlined the fact that they're struggling to find persons responding to advertisements, responding to the vacancies, and that too poses a challenge for them. So we have been able to look at the structural issues, the human resource challenges. They themselves also spoke about indiscipline within the system, absenteeism from work, the abuse of, what do they call it? Sick leave. The abuse of sick leave, and private doctors being used in the process of aiding this abuse of sick leave, especially for key and critical staff. And they've asked that strong measures be recommended because this affects productivity and efficiency in the delivery of service. So we have had this opportunity to listen extensively, to discuss fully, and to come up with a plan that would hold everyone accountable. Our health centers are not only there when you're sick. Our health centers are centers of continuous support. So for example, we don't expect someone in a sub-region in South Rupununi to have to come to Lethem anymore for tablets. From their health centers, they can pick up their 3-month supply and it's replenished continuously. Very soon, we will decentralize the delivery of medical supplies in the regions themselves, so that in the regions, they will have their entire year's supply. And through an electronic platform, the daily use will be managed and reconciled. So the Minister of Health has been asked, for example, to ensure that by the end of this month, every region would have the demand chart for the entire year, and then the region is expected to have that demand chart further decentralized to the district level, so that there is no gap or lag time. And in the daily monitoring, we can see how we replenish the stock levels. The system is there. The investment is there. The government is buying all the medication that is needed. We are buying the textbooks. We are buying the exercise books. We are buying the teaching material support. And to add to the quality assurance, we're going to implement a government quality assurance body in every region that would include members of civil society that would help us to ensure the quality of service and consistency of service is delivered. I'm going to ask the Minister of Education to first speak on what are some of the areas the ministry is going to focus on as we look at this community approach of improving service and delivering better education service. Then I'll ask the Minister of Health to speak on some of this, the Minister of Local Government, and then of course the Minister of Finance will say a few words. Priya. Just press it.
Thank you very much, Mr.
You can speak
President.
from afar.
Good afternoon to everyone. Led by His Excellency today, we had an extensive examination of service delivery in the regions from region 1 to 10, and had a frank and candid examination of what our challenges are without the glare of the media or any other hindrances. I felt it was very productive because we heard directly from the service providers, the RHOs, regional health officers, the REDOs, the regional education officers, what some of their challenges are, but also what some of their solutions were to challenges given resources that have been provided over the last 4 years. So what we saw, what my takeaway from this is that we have challenges in various areas, but that given the direction of the PPPC government led by His Excellency, given resources that have been plugged into the system, the management of those resources, both centrally and regionally, have resulted in better service in a variety of areas. Infrastructurally, let's take education for example. Infrastructurally, we are better off regarding services like textbooks and exercise books and school feeding and getting teachers into schools, training teachers from their homestead, from their communities, appointing more persons who can manage the system. Those are all successes that came about because of a deliberate injection of financial resources that came about from the will, a political will to see our education system do better. We heard though that there are challenges. I won't repeat them, but from the president you heard about our human resource challenge. For example, if we're going to build 37 new secondary schools, considering that we have in the whole country, for the whole existence of Guyana, we have 116 secondary schools. And in one 4-year Irfaan Ali term, we're building 1/3 of what currently exists, or a little bit more than 1/3, but with the same number of engineers. That poses a challenge. How do we get past that challenge? What I think the officers who are in charge of the various regions are assured of is that they will get the support and the resources needed to get past those challenges. Of course, we're all called upon, each and every one of us, in this build out of our new Guyana, to pull from ourselves all that we have to offer. From our very bellies, we have to pull up, give more, offer more, do more, to bring us to a place where Guyana can offer our people more, our children more, their parents more, hope to every community, the delivery of service, regardless of which mountaintop you're living on, which valley you're living in, which bank, which shore, that everybody is going to get service equally and equitably. And I think I want to end again by thanking His Excellency for leading that off, because if you were to look at our sector plan in 2020 to 2025, you'll see that one of the biggest challenges we named was the interagency collaborations, because it requires so many people getting involved and doing one service. And that is something that was not only clarified but identified in a very sharp way today, about how each and every one of us across the country needs to up our games in respect of the service that we have to provide. I am personally very pleased and very proud of what we've been able to do in the last 4 years, but also very, very happy to know that we have and that we can continue that with a renewed focus and renewed resolve in this last year of Irfaan Ali's first term. And so we're very happy. I was very happy to be a part of this. I thought it was productive, and I believe everyone who came from education sees this and saw this as a productive activity that could take us forcefully into this new year with renewed resolve and a more direct focus on what our delivery and our mandate is and will be.
For example, to tell you a bit about what took place in education in Region 9, the transformation and what they're doing there to improve efficiency and ensure the children of Region 9 have this world-class education we speak about.
So do I need to take these over?
So in Region 9, we are simultaneously, we are presently constructing 7 secondary schools. History can prove to you that was never done in the past. That was never ever done in the past. And kudos to the stewardship of His Excellency President Ali and the education team. Every single teacher in the Rupununi, is either trained by this year, or if they're not trained, they're enrolled in the CPC training program. So within the next few years, every single teacher will be trained in the Rupununi. Every single village of the 57 communities in Region 9, they now have either access to secondary education, primary education, or nursery education. So every single area, children will now have access to minibuses, either bicycles or a boat, to be transported to a school. So never before in the history of Region 9 you have access to secondary education. So a lot of things have been done in the Rupununi, and we will continue to work very, very hard to ensure that every teacher has accommodation. Every teacher has proper accommodation, a bed. Every teacher has the basic, at least 5 basic things in their house to be reasonably comfortable. And we believe at the regional level that if a teacher or any government worker basically has these basic things, they would give our children 110% education. And that's what we believe. That's what we're following from His Excellency's instruction. So, Mr. President, I can assure you that we will continue to work from my perspective and the Redo's perspective, that your services will reach every single village in the Rupununi. Thank you very much.
Good afternoon. Like Rio and the other speakers, yes, in healthcare we have seen tremendous progress. If we look at various areas of improvement in terms of access to care, Region 9, we believe that taking healthcare to the individual is essential, and that is in keeping with one of the major aspects of ensuring access, and that is led by His Excellency. We ensure that for every village, 57 villages in Rupununi, that there is a specialist group that is poised. They're put together based on the needs of the areas, and we ensure that once every month there is a team that will visit every sub-district and ensure that persons are seen in their homes and they are receiving adequate healthcare services. There's a whole package of obstetric gynecology, surgical review, backpack x-rays being offered for persons in their village, ultrasound services, the array of laboratory services, and this is something that has never existed, and we're proud that this can be achieved and is going a far way. NICU services, we look back at, prior, there were 90% of our babies had to be referred for critical care. Now, just about 3%, they're all dealt with within the region and are receiving adequate care. We look at our patient care services. We would have seen just about 20,000 patients would have been seen per year. We've increased that dramatically, and now would have seen some 6,000-7,000 patients if we look at the fiscal year 2024, and that has been improving in terms of what has been done. Referral. So we have a relationship with Brazil in the case of patients being referred for services that we don't have. We would have dramatically reduced that, whereby now we are actually having referrals levels to 35% to now being just 2.5% and 0.5% coming to GPHC. And that's only for patients from Massa Canary, which we know the logistics and the difficulties there. Training, over the decentralized approach, we had 377 persons trained within Region 9 on the various various courses such as CHW programs. We had 3 of those. Nursing assistant program. We had pharmacy assistant, medical laboratory technician, patient care assistant, and now we're having the second cohort of the hybrid professional nursing program and the nursing assistant program. I mean, I could go on and on with the benefits in terms of how we would have improved drastically patient care. And generally what we're seeing is that their healthy life and expectancy for the patients that live there. And lastly, I want to add that, you know, services offered within Region 9 are not just only for persons that are Guyanese, but we offer services for Brazilians and other nationality free of cost. Last year, we recorded some 445 persons, Brazilians, had major surgeries done at the Lethem Hospital, and even surpassing all of the surgical historical data that we would have had in terms of surgeries done in Lethem, to have some 1,340 surgeries done.
All the medical supply needs of residents are met in 2 months supplies now. So they get 2 months, and we're going to take that to 3 months. The team has been doing enormous work. Just look at 2 issues there. Referral rate from Region 9 to Georgetown Hospital went down to 0.5%. 0.5%. So that is just to give an example of when we say we're delivering world-class service and quality service, what we mean and how it is being achieved block by block. And this is in a difficult region like Region 9, both for education and health that we spoke of. So Frank, maybe.
As Minister Manik Chan would have said, we had a very productive day. We had an opportunity to interact with the RHOs and the REOs and the regional education officers, and to get a sense of what we're delivering in the region. For us in health, we have lots of accomplishments that we've been able to do over the last 4 years. As you heard from Dr. Makwat, there were things that were never done before and are now being done. And just to give an example of, maybe to pick up from where Dr. Makwat left off, in terms of surgical care, we have added more theaters in and around all our hinterland regions, and we're now able to do much more surgery than in the past. In some cases, the theaters in these regional hospitals were not functioning, and we were able to bring them to functionality, and we're doing surgery. In cases where they don't have a resident surgeon, we have been sending in teams so that those teams can do elective surgeries. And that has made a tremendous difference to the people of these communities. In addition, we have a very special program where persons with eye problems, we have been sending in our ophthalmologists so that we can check people's eyes, and if they were diagnosed with cataract, we put them on a waiting list, and we were able to bring them out to Georgetown at the government's expense, take them to Port Morant, where they'll be operated upon, and then they're returned back to their community. And over the last year, we would have helped more than 500 cataract patients who are now seeing, having had their surgeries. In terms of community services, before, while we might have had a health post or a health center, most of these facilities were without any staff. and we had to train people. So at every one of our health posts now in the interior of Guyana, we have at least 2 community health workers, and they have been tasked with delivering a set of services that the ministry has identified. And if they have patients that come to them and they're not sure what to do, we have backed them up with telemedicine. We now have 8 to 9 telemedicine sites that we operate in these different regions. And our intention is to expand that. And we've seen the value of having telemedicine because it has made a tremendous difference. So for example, in Guns, we've had a case where there was an infant that went to the health center. The community health worker was not sure what to do, and they dial up the doctor at Georgetown Hospital, and they had a video consultation, and because the doctor recognized how critical the baby was, we were able to send in a medevac immediately for that baby. Brought the baby out to Georgetown, and the baby was given treatment, and that baby is alive today. If we didn't have this system, that baby would have been dead. And that's the kind of difference that is being done on a daily basis with different communities, but it's making a really, really big impact. The system obviously is not perfect. We do have challenges. And today we had that discussion where some of those challenges that we have identified, we are going to work and make sure that we rectify them. But the investments that have been made by this government has certainly changed the face of how we practice medicine in every community in this country. And we have been able to deliver, I would say, very good service, but we want to make that better and even make it the best possible service that we can deliver, and that's what we've been working on.
Is how do we scientifically approach public health in Guyana? And only today, the ministry, I had a chance of looking at the data from the ministry. Take, for example, the HPV program and the testing, cervical, the cancer testing. From that exercise, they were able to gather very important public health data. Data now that tells them specifically what are the type of strains or the type of
HPV strains.
HPV strains that exist among our population. So you can have targeted investment. You can deal with the strains that are prevalent here in a more targeted way. So these things you don't see that result, but these things are important in that quality healthcare delivery. And when you look at more than 60,000 spectacles, not just the tests that we delivered last year alone, more than 60,000 of our elderly persons now have a spectacle because of that program, because not only did they have the voucher, but those who needed spectacles who proceeded to purchase that spectacle for them. I'm going to ask one of the hospitals, one of the regions that is growing at a very rapid pace in not only economy but in population is Region 3. And with that pace of growth, of course, comes specific challenges, especially in public service and so on. And whilst they have had to overcome many challenges and still have challenges at West End Hospital and the other facilities there that they're working on every day to improve the service, they have had tremendous accomplishments also. And it's good if you listen to Erica about some of what is going on there. Are you there?
You rightfully said, we have had many difficulties in Region 3 in overcoming health services. But while we are not there yet, we are continuously working to improve the services. And a lot of the great things that we have done over the past 4 or so years. First, I'd like to talk about our surgical approach. We moved from just one operating room within the operating theater functioning during the day alone to opening up both rooms. It's a small operating theater. As you know, the hospital is old. However, it's 24-hour services. That means that we're doing surgeries day and night. What this means for people is that they no longer had to be transferred for frivolous, although surgical needs, things throughout the night. This led to a 97% decrease in our referral rate to GPHC. 97% drop in our referral rate to GPHC. That also improved on the quality of care that we were giving to persons, because they didn't have to go through the stress of having to maneuver the bridge and these things in order to get over there. We also introduced laparoscopic surgery into the region. So we're now doing these major surgeries through keyhole approaches, which of course increased the expectancy of persons and their ability to get back to work, offered right at the West Demerara Regional Hospital. We also do a lot of deliveries at this hospital. For 2024, we've done over 1,700 deliveries right at West Dem. That is a tremendous amount. We've never done that many in the region before. That just shows that persons have, they trust the hospital services even more. Or it could mean that we're also, producing a lot more now. It's not just that we're having deliveries. It's also our NICU services, our babies that are required to be transferred to GPHC for NICU services. We now have the second largest NICU in the country. We're not just seeing our babies from Region 3. We're also offloading babies from Region 2, from Region 7. We even accepted a baby from Linden, baby from Diamond. So we're not just seeing the patients within our region, we're seeing the NICU patients across the country now as well, because we're managing these babies right at West Dem. We're also pushing for more outreaches so that we can also reach the patients in their home. Every month, we visit the larger islands like Wakenham and Leguan, and we take all the services, their ultrasound services. We take our specialists, we take OBS and gynae, so that everyone can be treated right on the island. We also have introduced into the region echoes. So patients now with heart issues can have their echoes done right in the region. We've also been liaising with Region 6 to have our cataract patients do their surgeries. So Region 6 will send their specialists over to us. We would have had a list produced in our region before. We would have them screened by the specialists who would come down. We would then have those patients, we would transport them to Region 6. Region 6 will do the surgery on them. They will house them, take care of them, and when they're ready to be discharged, we collect the patients and we bring them back. That's ensuring that it is no cost to the patient to have their eye surgeries done. So even though we can't offer that surgery in the region, we're ensuring that persons still access this surgery. We've also decentralized other services like physiotherapy. We now have physiotherapy being offered to our special needs school. We have physiotherapy being offered within our communities, like the larger communities like Parfait and Perico. So there's a whole host of things that we in Region 3 are doing to ensure that services are being brought to the people. And we're also really looking forward to the Dickinson Hospital that will be on board very soon. This is going to also ensure that we have improved services, because it's going to ensure that we have our own CT scan and these other specialized services right in the region. So our referral rate will likely drop to 0 once the Dickinson is on board. And we also have the West Dem Hospital's new construction that will be brought on board very soon. Soft turning will be done very soon, as you're aware. This will also remedy some of the issues that we've had to face at West Dem, because the issues at West Dem aren't just staffing or small things. It's that we're dealing with a very old hospital and there's only so much you can do with it. And this government has seen it necessary to ensure that the services meet and match the expectations of the people. So the investment was made to ensure that the hospital's infrastructure is there. So we're going to also have a brand new West Demerara Regional Hospital. And that's just a few of the many great things that we've been doing while we're fighting our challenges in Region 3.
And that brings challenges. So for example, in Region 3, the demand for medical supplies and medication has increased tremendously, because they're doing more surgeries, they're seeing more patients, they have more people attending clinics. So they have a challenge now of having sometimes not shortage, but sometimes a delay in the lag time in the supply of delivery to patients. So they are now working to fix that gap and to have better projection planning so that they can deliver by February of this year 3 months supply to patients also, and not have anyone waiting for the supply of medication and medical supplies. And they're working also on ensuring this is done at a district level, at a health center level, which is key and critical for them. So that is one of the challenge, the major challenge that they will overcome, but there is a clear strategy on how that will be done. Let me ask Sonia.
Mr. President, colleagues, and all this afternoon. Good afternoon to you all. I was very happy to be a part of this meeting. I thought it was very necessary. And like my colleagues, I believe it was extremely productive. It was comprehensive because you have so much investment, tremendous investment by His Excellency and his government in relation to the financial resources in health and education. And His Excellency made it clear even before he became president that healthcare, education were two of his priority areas because they targeted vulnerable groups in our society. And so from day one, the investment has been tremendous, and it has been growing since then up until 2024, and we'll move forward to 2025. Now, for these investments have borne fruit, because much fruit, low-hanging fruit, everything, because the sectors have also been integrally involved in pushing it at such a rate to be able to be successful, but not successful just because we have money invested, but to make sure that our people were satisfied. To do that, the local governance structure is extremely important. And so His Excellency chose to have this meeting with all these sectors involved, because without the strengthening of the system, that is the regional system, the regional health officers, the regional education officers, and all those who play an integral role in ensuring that these services meet the people directly, that he had to ensure that we have this meeting to put on the table our challenges and ensure that we can strengthen this system so that we can improve further on the delivery and the quality of the delivery of services to the people, especially in the health and the education sector. This completely, besides this, and this is to tell you how people-centered every strategy and every initiative that the President brings up is. He also recently spoke of putting a permanent citizens desk in every NDC that will have a consolidated set of services that will be accessible to the residents in any given community. So that you will know about pensions, you will know about public assistance, you will know about passports, you will know about all of these services, right? So health and education, today we are dealing with those things fully, and a regional system. I think at the end of a very long day, but a very fruitful day, everyone is on the same page as to how important it is that we make sure that the people are happy with the services that they are receiving. And to start with that, the President has put minimum standards in terms of infrastructure, in terms of setting up a committee, a quality assurance committee or board or body to ensure the monitoring. And this is where the regions are integral, the monitoring of everything that is being done through education, through health, to make sure that it meets the people and meet the people in a satisfactory way. So I think this was a very welcome meeting. I think for everyone sitting here, we clearly understand the mandate, and moving forward, I think we've done so much, and we have improved on all of the services based on the investment and based on our will to do it. But we also have identified our challenges, and we know the way forward now. We're the way forward, and we're going to continue making the system even stronger to meet the needs of our people. Thank you.
Good afternoon, everybody. I must say, His Excellency, this was a good approach to meet with me, and I am overjoyed that you got to hear from me personally how I feel or what education has been doing. The process today for me was a good one because everything came from, in my work life, came full circle. Because yes, we report to our ministers, to our deputy chief every week, and the same thing that they've been saying, I'm seeing it today, that it came from the top. Because you are the driving force behind education, and I must say thank you for that. Would have served, as His Excellency said, in 3 regions, and I am happy today that I would have been able to serve under your leadership, bringing things to fore that we can carry to the people. Improvement in textbooks, in delivery of textbooks to the children. Teacher improvement, train teachers. Presently, I'm in Region 4. All teachers are either in training or are trained. Expansion of schools across the country, in Region 4 particularly. We have 2 new secondary schools that will be on board, Caneville and Prospect. Expansion of Yarra Cabra Secondary, where presently we're catering for over 1,200 learners. And we have a 10-room expansion there because the population is growing. This government has been doing tremendous work, and I'm happy that I'm a part of it, that we can meet the people's needs and continue to grow. School feeding, just to name a few. We have our new schools within the region. We have Nonpareil, we have Swan, Falls. Those are some nursery schools that will be in operation come September. We have improved services where we do community outreaches so parents can understand the importance of education. And if we don't have your driving force behind us, we can do so much and no more. So thank you, Mr. President, for outlining today. Now that we can go back to our regions understanding that we are working with a goal and a purpose to meet the needs of the people of Guyana. Thank you.
Thank you very much, Mr. President. Let me first of all thank you for convening this extremely important discussion and for inviting me to be a part of it, sitting alongside my cabinet colleagues. I'm particularly pleased that we've had this discussion today for a number of reasons. The first is, as always, we saw once again our president leading from the front. And I've had the privilege of serving in President Ali's cabinet over the last 4 years. And there isn't a single sector or a single area of government work or government policy or a single set of issues that we have not had the privilege of strong leadership from the very top. And I know that everybody present today saw that in full flow and a full demonstration, once again, of strong presidential leadership, strong leadership at the top, and in particular strong leadership in relation to 2 sectors that really are at the core of our national priorities. So, Mr. President, I want to thank you for devoting the whole day, essentially, to this conversation, which was so important. Secondly, Mr. President, and ladies and gentlemen, I want to reiterate that we were speaking essentially about health and education. And those are 2 sectors that, as I said just a minute ago, go to the core of the well-being of people and about the future of our country. We know, everybody knows, that our country is going through a remarkable period of transformation. Our economy is growing faster than any other economy anywhere else in the world. We are achieving national prosperity at a pace that is completely unprecedented anywhere else in the world. And we know, we've seen, I mean, we're having this conversation just a few days after the national budget was presented in Parliament, and in which we reported on the continued extraordinary growth of our economy. But this People's Progressive Party government, under President Ali's leadership, has always said that national prosperity must be translated into community, household, and individual prosperity. And there could not be two issues more germane and more essential to individual well-being and individual prosperity than health and education. We hear it said very often that no price could be put on your health. And that's really true. We know that at a personal level, that no effort should be and could be spared in order to ensure that you are, as an individual, in good health. And similarly, at a national level, President Ali has taken the position that no effort will be spared by his government in ensuring that the Guyanese population as a whole is and remains in good health, because a healthy population is essentially for the long-term well-being of our country, and a healthy population is essential for individual comfort and individual well-being. And at the same time, there could be nothing more important, and families all over the world know this and repeat this, that there's nothing more important to invest in than in the education of your children, because the education of your children is essential to their well-being, their ability to have the relevant skills that are needed for the economy of tomorrow and the country of tomorrow, their ability to get a good quality job, their ability to earn a decent income, their ability to develop themselves and realize their potential, and of course their ability to contribute to better communities, a better society, and a better and more prosperous country. Nothing could be more important equally than an investment in education. The Guyanese public would know that in Budget 2025, we announced the largest ever investment in both the education and health sectors respectively. Budget 2025 provides more than $143 billion for the health sector and $175 billion for the education sector, a completely unprecedented level of investment in these two sectors. And as you've heard from my cabinet colleagues who have spoken before me, and as you know, we are doing far more in these sectors, as we are in every other sector. We're doing far more than we've ever done before. We're building more schools, building more hospitals, training and recruiting more teachers and nurses and doctors. We are buying more textbooks, providing more school meals. We are buying more drugs and medical supplies. We are rolling out more modern world-class equipment in our hospitals, including, of course, digital equipment, digital x-rays, other digital scanning and imaging equipment, telemedicine centers that Minister Frank Anthony spoke about, etc. So we're doing far more, and we're doing it far better. But President Ali has also said that this modern Guyana that we're building must not only be a modern Guyana in terms of the things that we see, newer, bigger, newer, better equipped hospitals, etc., but it must be a more modern Guyana in terms of the things that are not so visible, like, for example, the qualitative changes that are needed in the citizens' experience in accessing government services and in the quality of services that they access and the ease with which they access these services. And those qualitative things sometimes are not, or oftentimes are not as visible. They're not as visible as the brand new hospital building and the brand new hospital beds and the brand new school buildings and the brand new smart classrooms that we're deploying. They're not as visible, but they're just as important in realizing a world-class education and health service. And so what we had today under President Ali's leadership was a full and frank and exhaustive, not exhausting, I don't think any of us got exhausted because it was such an interesting discussion. But what we had today was a full and frank and exhaustive discussion, comprehensive discussion on some of the critical issues that we need to pay attention to make sure that we raise the quality of service that is provided in these two sectors, and some of the minimum standards that should be set and that we are now setting in terms of service delivery in these two sectors. I want to make one final point. President Ali has embraced the theme, the philosophy, the core philosophy, the conviction of one Guyana to mark his presidency. And there are many, many dimensions by which one Guyana can be interpreted. But I want to highlight a particular dimension that oftentimes, sometimes, that often doesn't get the kind of prominence that it deserves. Having worked as closely as I've had with the President, I know that an important dimension of one Guyana is the geographic dimension of Guyana. Guyana is a very diverse country. It has major urban centers like Georgetown. It has rural coastal communities, and it has hinterland communities. And I know that the President believes very strongly that the transformation that we are experiencing today must not only be seen, must not only be experienced, and must not only be benefited from in our major urban centers or only on the coast, but must be experienced and felt and benefited from across the country. And so, gone are the days when you can only get access to good quality health care if you come to Georgetown. Or gone are the days when you can only get good quality education if you come to the coast or if you come to Georgetown. And I know that, and we have seen the President's conviction that good quality health care and good quality education must be available to all of our citizens, no matter where they live, no matter which region they live in, no matter, first of all, if they live in an urban center or a rural community, no matter if they live on the coast or in the hinterland, no matter if they live in the most remote village in Guyana. Good quality education and good quality health care must be available to all of the citizens of Guyana. And there are many other dimensions too, including, for example, the Gold Scholarships program that we have rolled out, that now means that no matter where you live, you can get access to higher education using online and digital technology. And so this conversation, bringing together all 10 regions, bringing together the REOs, the RHOs, the REDOs, and of course, obviously, the sector ministers, brought together all 10 of the regions, the lead technical officials in all 10 of the regions, to reinforce this point and to have, like I said, a full and frank conversation about what needs to be done to ensure that this world-class education and healthcare that we, this People's Progressive Party, civic government under President Ali's leadership, that we are committed to delivering. What are the things that need to be done now to make sure that the investments that we're making bear fruit and that we realize this world-class service to all of our citizens? So, President Ali, I want to thank you very much for leading this discussion yourself, not leaving it to any one of us at a ministerial level, for leading it yourself, as you always do, providing leadership from the very top. And I really do think that it is an extremely productive discussion and one that will bear fruit in the shortest possible time. So thank you very much.
Anna?
Yes, good afternoon. Let me first express gratitude to His Excellency on behalf of the people of Region 10 for the investment that have been made over a number of years. Health financing, I must say, would have increased over 40% for the past 4 years. And with the increase in health financing, we were able to develop a healthcare system that is able to respond to the growing public health needs of that region. Now, one of the things that we would have done in keeping with this excellency vision of creating a world-class healthcare system is to divide the healthcare system into two parts, where we focus on access and processes of healthcare. With respect to access, we would have constructed and rehabilitated a number of health facilities across the region so that they can cater for the growing needs of the region in terms of new services, and access also would cater for walkway pathways so that patients, wheelchair access, so that all different types of patients can access quality health care. Now, with respect to processes, which is very important for us, processes speaks of the different types of services. Doing an analysis of the healthcare sector of Region 10, we would have realized that there are certain basic needs that we have to provide in order to cater for this specific public. Now, with respect to the Linden Hospital complex, over the number of years, one of our main challenges there is that we would have been functioning with one biochemistry machine. And whenever there's an issue with that machine, the service is down. But I can say, now we have 2 functional biochemistry machines in our lab, so that at any given point in time, we have that services available. In respect to blood gas, it's the first time, HE, that we're seeing that persons of Region 10 now have access to blood analysis services at the Linden Hospital complex. In addition to upgrades that we would have experienced in our laboratory services, we would have seen tremendous investment also in our radiology department. 2 years ago, we would have upgraded our former X-ray system, which is mostly an analog system. With the analog system, it used to take you roughly around 30 minutes to get that result. With the upgraded version, which is a digital X-ray system now we have in place, within seconds you have your results. So that is a great improvement for the people of Region 10. In addition to that, on Monday we will be commissioning our mammogram machine, and this also, why I mentioned these 2 things, Your Excellency, is that these 2 important, in addition to our CT scan machine, which we'll be getting this year, would reduce the economic burden of the people of Region 10 to access these services. In the past, persons used to have to travel to Georgetown to access these services. But now with this equipment in place, it will reduce the out-of-pocket burden for the small man within the region to access these services. And this is a great achievement for us in Region 10. Drugs and medical supply have been an issue for us. When we took office, Region 10, our supply was below 50%. Today we can boast of a system where our essential drugs, our vital drugs are above 90%. We would have put systems in place to ensure that every resident of Region 10 have access at any given point to essential drugs. Some of the systems that we would have put in place, one, we would have asked the service providers at all the healthcare facilities to have a 25% restock level. As soon as our stock levels at 25%, you have to restock. Secondly, we would have trained the number of personnel within the healthcare sector in LMIS training, which is basically a logistic management training to assist us to understand the forecasting procedure. So that will help us to do our forecasting correctly so that we cater for the amount of or have accurate data in terms of our projection. Thirdly, the government would have ensured that we have finances available at any given point of time to purchase emergency drugs so that patients at all times would receive or have access to healthcare delivery throughout the region. With respect to health transportation, this was something that was plaguing Region 10, especially in the outlying communities where persons, the healthcare workers, had difficulties taking healthcare to the people or doing home visits. Today we can boast that within our region, over 90% of our healthcare facilities in the riverine areas have a functional boat and a functional engine. And now they're taking healthcare to the residents. Home visits are being done on a monthly basis. And coupled with this, we have specialized medical outreaches on a monthly basis to those areas. And all of these different systems that we would have put in place is to reduce the economic burden of the citizens of Region 10. Because it doesn't make sense you offer free health care and then you have to pay a lot of money to access that. So we would have put systems in place to reduce that economic burden. And that is something that we're focusing on throughout that region, and in keeping with His Excellency vision also of creating a world-class healthcare system. The Ministry of Health would have invested in telemedicine across the region. We have 10 functional telemedicine sites in the outlying communities. And the central hub is at Mackenzie Hospital, where at any given point of time on a 24-hour basis, persons in the outlying areas have access to specialist doctors or consultants if there's an issue. Those are systems that we will continue. This is something that we will continue to build on. Our hope is to have all the outlying systems, all the outlying areas of our telemedicine center by the end of 2025. And this is something that we would have discussed with our minister, and he's very adamant, and we will accomplish this because this is the vision of His Excellency of creating a world-class healthcare system. So we want to thank you once more, Your Excellency, for your investment and your vision, and rest assured that the people of Region 10 will continue to work in supporting your vision. And in addition also, I must mention training. We would have benefited a lot from training. I know from time to time you would see in the media that the nursing school, persons would say that the nursing school in Region 10 has been closed. Rest assured, the nursing school has never ever been closed. Only last month we would have graduated over 50 persons from the nursing school. So the nursing school is functional. We would have also graduated over 50 persons in the CHW program, pharmacy assistant, and the lab technician program. And in April, we're going to launch 50 persons. We have already started the process of launching the patient care assistant program. That will be launched shortly within the region. So the government is actually investing tremendously, like I've said in the beginning. Health financing has increased tremendously within the region, and that financing, that investment has put us at a place where we can respond effectively and efficiently to the growing public health needs of Region Number 10. Thank you.
I have an excellent cabinet, a team of ministers who work every day with a technical team, and they too are not working alone. They work with a technical team. A lot of teamwork, a lot of creativity, a lot of hard work has gone into making things better in the last 4 years and improving the lives of people. And yes, as I said, a lot of challenges we still are going to address. I said we set new standards today, minimum standards for health and education, for what every facility should look like, what basic efficient service delivery must feel like, which include patients having 3 months supply of medical supplies, which include having stock out levels. Very soon you will see the implementation of the diversification or the stockpiling of drugs in the regions and districts themselves. So this is about building blocks and making it better every day. And I'm so excited about the enthusiasm also from the public servants and they themselves acknowledging where the challenges are and where the weaknesses are, even if it is within the system itself that they are in charge of. But a lot of young people also now taking up the challenge. I'll ask finally the RHO from Region 1, because I want you to understand the breadth of transformation that is taking place, to tell you a bit about what is happening there.
Mr. President, first off, I want to thank you for giving us this opportunity, especially me. I know that I've been around for a while. I've been a doctor for almost more than 12 years. I've worked in many regions. And just to note, Mr. President, I visited Maikoni Hospital only last week, and the transformation in that hospital was tremendous. I was shocked. I had to call the RHO right away and say, Doc, this is tremendous. I have seen the transformation because I'm from Region 5, and I have seen what my Coney Hospital was and how it is right now. I visited Georgetown Hospital, and I mentioned it a year ago. The system is so fast, it's better. And there's only one thing that I can conclude, that the government and the Ministry of Health has ensured that the services in healthcare are always delivered in a timely fashion, they're affordable, acceptable, and accessible by every citizen. The same was emulated in Region 1. What we did in Region 1 was we transformed the system. The system, when I met the system, and I've been in Region 1 since 2020 to now, the system was broken. I have seen the transformation in Region 1, and the residents of Region 1 can see that transformation for themselves. Let's look at staffing. In 2020, we had 69 nurses. Currently, we have 124 nurses, and we're in a few days, we're going to get some more nurses because we finished 19 NAs on the hybrid programs, and we also just graduated 24 new NAs from the Hinterland training program. This has never happened before. Adding to that, we've added over 102 CHWs to the system. Communities that never had health workers, Barbina, Cans Hill, these communities never had health workers. They now have 2 health workers, 3 health workers, and some of the health workers that graduated in 2021 are now upgrading themselves to being nursing assistant and registered nurses. This is a model that has been set in these hinterland areas to show people that it is possible to improve your state of being. And this is being seen all over. Look at Baramita. In 2020, when I visited Baramita, the floorboards, and I kid you not, the floorboards were this big apart. You could have seen straight through to the ground. Right now, you need to see Baramita. Serving a population of over 4,000 persons, Baramita has one of the, to me, a very, very, very good service for any hinterland region. We have a doctor, we have medics, we have nurses, we have midwife. The hospital there now have departments. They service the community. This is what we see happening in Baramita. We have persons from Baramita that are now trained as microscopists, CHWs, nursing assistant. In a few days, we're going to get a medics that is graduating from the University of Guyana, the associate's degree program. That medics is from Baramita. His name is Hakeem Henry. He'll be going right back to Baramita. This is now a role model for the people of Baramita. We are motivating people to making them better. We don't have a perfect system. I'm not going to say that we have a perfect system, but let's reflect of where the system came from. And that is how you'll see the amount of emphasis that has been placed in healthcare and in all the facets of society. When I was in Region 1 in 2020, we had 1 ambulance in Mabaruma, 1 ambulance. Right now, we have 6 ambulances, that's ground ambulance alone, and 3 water ambulance. We have even put an ambulance at a village way up the Barama in Kariako. These places never had ambulance access. They don't have anywhere to reach Kariako through the river alone. Now you have a water ambulance there, and there's a way for persons to access health care. This is what you call transformative healthcare services. And I'm proud to be a part of this system. I'm proud to see the system grow. I'm proud to grow with the system. And I'm proud to be, serving under the leadership of His Excellency Dr. Irfaan Ali and the Minister of Health, Dr. Frank Anthony. Their motivation and the drive, that's what motivates you. Because you know that there's a force behind you that is pushing you. And that force is what gives you the energy to push forward and move on. I can go on and on about the facilities and infrastructure investment in Region 1. Every single facility would have benefited from some sort of improved infrastructure. But I want to focus on the larger facilities like in Whitewater. Whitewater controls 2 landings, the Gaja landing and the Bamboo landing. These areas are very close to a bordering community, Venezuela. When I visited Whitewater a few years, I think in 2020 during the COVID crisis, Whitewater was horrible. Horrible. That's what you could describe it as. I want us to visit Whitewater now. We're currently transforming Whitewater into a polyclinic. But the center that's there offering service, you have a medics that is full-time there at Whitewater. You have nurses, you have CHWs, you have microscopists, you have a pharmacy, you have a telemedicine site. All of this there is offering at Whitewater. We want to, with the addition of the polyclinic, we're going to add a diagnostic wing. They'll have a lab, they'll have an X-ray, a portable X-ray unit, and they'll also have the dental department there. Back in 2020, these things were never there. Barmita never had a dental clinic. They have a dental clinic now. We had one lab in that region, one lab at Mabaruma alone. We have 4 labs now. We had 1 X-ray unit at Mabaruma alone. All 3 of the sub-regions now have X-ray units. All 3 of the sub-regions can benefit from ultrasound. We only had 1 ultrasound. There was 1 theater at Mabaruma Hospital alone, and it wasn't functional. That theater is now running 24/7s with a full complement of surgeons, gynecologists, and orthopedic surgeons. We had 2 specialists when I got to that region. We have 6 now, and we've extended specialty services to Comaka District Hospital also. We're doing surgeries in Comaka, lab services, all of that is being offered at Comaka. So I want to summarize this by saying that this is the best example that I can see of something that is pro-people, pro-poor, and productive. Mr. President, I'd like to say, that's my definition of what PPP stands for. Pro-people, productive, and pro-poor. So thank you, and thank you for the opportunity, and I'll continue to serve beyond 120 and 150%. Thank you.
Young leaders, you're seeing them, and that is a commitment that I'm so proud of all day. And you know, the People's Progressive Party civic government, of which I said we have an enormous cabinet, we have supported by excellent public servants, and we are not saying that today we didn't come here to gratify ourselves. We came here for a very soul searching, I would say, internal soul searching in the interest of the people. We had a full, open, transparent evaluation of the system, of everything that is going right, everything that needs improvement, every challenge, every opportunity, every threat. But at the end of it, we came out knowing what is the objective. That is to deliver the most optimal service and the highest quality of service to the people of the country. So again, I want to thank everybody. And after a long day, I think they have long travels back, safe travels back.
I can't have something up there, buddy.